We're going to talk about yeast infections during pregnancy. If you want more specific details, feel free to hit the link at the right. That'll take you to defeatyeast.com. It has a lot of specific details about what to do. But we're going to go ahead and talk about yeast infections during pregnancy. There are several symptoms you should be aware of. Swelling of the vagina, pain during urination, painful skin cracks due to extreme dryness of vagina, general fatigue and lethargy, walking difficulties, scratching the area causing bloody exudation, bleeding and swelling of hemorrhoid veins, and difficulties having sexual intercourse. Looks like I spelled intercourse wrong, sorry about that. But these are the symptoms that you would have if you do have a yeast infection during pregnancy. It's important to note that when you notice some or all of these symptoms, you should talk to your doctor. Yeast infections may start out minor, but they can develop quickly into a large problem for both you and your baby. Remember that yeast is in your entire body, so you cannot treat just one area. You must treat the root of the problem and get to all of the candida. Candida, by the way, is another name for yeast, so I'm going to use those words interchangeably. But remember that if you are just treating one area of your body, you are not actually getting to the root problem. Yeast infections are not all vaginal. It can settle in the mouth, also known as thrush, or again, candida. If you do have candida in the mouth, it can give a dry mouth feeling. You'll see creamy white patches that coat the tongue, tonsils, throat, and cheeks. Sometimes there's pain on swallowing. It could also cause heartburn and feeling of pain behind your breastbone, such as nausea and vomiting as well. So these are some other symptoms of candida, or it's also known as thrush, which is basically a yeast infection in your mouth. What happens if you ignore it? If it becomes systemic and settles in different areas of the body, serious conditions occur, such as fever, heart murmurs, enlargement of spleen, bleeding disorders, blindness, which would be a severe candida or yeast infection in the eye area, shock, and kidney failure as well. So it's very important that you don't ignore it, because it can also adversely affect your baby's health as well. In short, you basically need to take action, educate yourself, learn what causes yeast or candida infections, and attack each cause. Be the answer. You can get a lot more information about natural remedies at defeatyeast.com. That's www.defeatyeast.com. We have an informational blog. We have lots of helpful resources, specific detailed videos with actual home remedies that have been shown to work about how to get rid of your yeast infection. This video was focused more on the symptoms, but we have several others that talk about not only the causes but also the cures. So check out defeatyeast.com, and best of luck for you.